This is interesting. Some of you remember last summer when we had already passed as a state medical marijuana, and we're looking to the health department to come up with some emergency temporary rules to facilitate implementing this. Well, so here's what happened. It's just, I tell you, sometimes you just can't make this stuff up. So we had a system where you could tell the legislature, what you think of the rules as they're drafting them. It's called a public comment period. Here's who didn't participate properly in the public comment period. It's a trade group called the Oklahoma Medical Association. It's not a state agency. Now, this logo here, the Oklahoma Medical Board, is a state agency. They're the overseers of the professional licenses of our physicians. Well, one of the requirements in Oklahoma, if you're a doctor or any healthcare worker who's licensed, is you have to have some continuing education. And the OMB, again, the state agency, decided to put this picture right here, this poster, this graphic, from the front cover of their website on promoting this upcoming event. It's called Pills, Pot, and the Politics of Pain. And it's being put on not by the medical board, not by the government agency, but by a trade group, the Oklahoma Medical Association. The group that probably was one of the most active in trying to kill this new medicine option for people who are facing getting kicked off of opiates by their pain management doctors, people in severe pain, people looking for something that works better than the tranquilizers the VA has them on for the PTSD. The problem with this, and in fact, if you want to take a look at Sooner Politics, we published this story today. The problem with this continuing education course is it doesn't have any real education for healthcare. You start out the course with, it's an all-day session. Of course, you got to feed them breakfast. And then we're going to have law enforcement talk. Then we're going to have former judge talk. And we're going to have, people with law enforcement agencies. And we're going to hear a story of somebody in recovery from an opiate condition. And here's the problem. They called it Pills, Pot, and the Politics of Pain. They're lumping, not medical marijuana. They don't want to dignify this medicine with a proper term. To them, it's still pot. Still pot. And they are going to, in the name of public health and protecting the health of our patients, they are going to reward people not for actually getting some good training, like is going to be happening here this next month in Tulsa. Laureate Institute for Brain Science is putting on a wonderful, wonderful continuing ed course. But the Medical Association, this Doctors Trade Association, isn't offering that kind of training so doctors can competently care for their patients with these new tools, the new cannabis medicine. No, instead, they are giving them horror stories about how terrible opiates are, and then they're lumping pot in with the opiates. I have a problem. I think we've got some problems with the OMB, our state agency. We definitely have a problem with a trade association that has a very ulterior motive. And I think we need to clean house yet again. So I talked to Chip Paul with, again, the Oklahoma Cannabis Trade Association about this, and his response is more of the same old, same old. He said, as long as this kind of corruption, the good old boy system of the entrenched agencies and the establishment special interest organizations have this incestuous relationship. And again, we're using our state agencies, our state agency website, to promote this private organization's political agenda. we've got problems. As long as this continues, those advocates of medical marijuana are going to continue to enjoy the moral high ground in Oklahoma. And it's sad that it is that way. We need to renew our confidence as patients, as citizens, in the agencies of Oklahoma, but they're making it very hard for us to do.